Good morning or afternoon or evening, wherever you might be in the world, and welcome to the International Population Data Linkage Network Conference for 2020. This is the presentations from abstract session focusing on ethics, law and governance issues. My name's Carolan Adams from Macquarie University, located in Sydney, Australia, and I'm going to be your session chair. In this session, we have four fascinating presentations. They'll be 10 minutes each, followed by 15 minutes of questions and discussions. If you have any questions for the speakers, please take the time to record them at any time during the session in the live Q&A chat that's running on your session page, and we'll come back to those questions at the end of the four presentations, and I'll get through as many of them as I can during that 15-minute session. So over to our first speaker, Assistant Professor Alison Paprica from the Institute for Health Policy Management and Evaluation at the University of Toronto in Canada. Alison will be discussing a qualitative study of public perceptions about using health data for artificial intelligence research. Over to you, Alison.
Thank you very much, Carolan. And hopefully you are interested in this topic, you can read more about it in our article that was recently published in BMJ Open, Conditionally Positive, a Qualitative Study of Public Perceptions about Using Health Data for AI Research. And I'd like to also acknowledge my co-authors, Melissa McCradden and Tasmi Sarkar. And in addition, we very recently, just last week, had a non-academic version of the content published in The Conversation, which has been picked up by, I think, over 20 news outlets. So that's a great plug for The Conversation if you haven't used it previously. So background, there's no question, it came up at the last session, public trust in big data health research is very important, particularly when we use data that is unconsented, i.e. Collected without express consent of the data subjects. And there have been a number of studies in Canada, the US, the UK. I think there's an excellent review by Mary Aitken and colleagues on the overall views that generally indicate that the general public supports the use of data for health research. They see it as an asset, but it's not blanket approval. They do have some conditions. However, when it comes to AI and machine learning research, AI/ML, we can't assume that that general but conditional support extends to AI and ML for several reasons. Foremost, we've got a really low understanding of what AI and ML are, coupled with some significant AI-specific fears, such as loss of control of malicious robots, job losses, and others. There's negative press about health data being used in AI. So for example, patients suing Google and the University of Chicago Medical Center. There's also concern that standard approaches to de-identification just aren't going to work in the face of AI capabilities. And then finally, what research there has been done on this topic tends to focus on patients' views, and in particular, patients' views on computer vision AI applications. And in those cases, the patients may stand to receive a direct benefit from the research. So what we're after here is really a better understanding of the public's views of the use of data for AI research. Our design was a qualitative study, 6 focus groups with members of the general public. We opened with a discussion about AI in general, and then we sought the reaction to 3 fictional but realistic health AI research scenarios in which big data were used. And we analyzed using qualitative descriptive theme impact analysis, which is very much a data near method. So there wasn't a lot of interpretation. You'll see many quotes in this presentation. The setting, 2 cities in Ontario, Canada, Sudbury, which is 400 kilometers north of Ontario, so the near north for us, and Mississauga, which is in the Greater Toronto area. And participants, 41 purposively sampled members of the public. And I will just briefly show you here that one of the things we were quite pleased with was the diversity of people that we had participating across a range of ethnicities, reflecting the fact that we have a very diverse population in Ontario, and also diversity with respect to income, level of education, and marital status. So in terms of results, we had mixed, mostly negative views about AI in general. And you can see from the quotes that flash up on the screen here, words like scary, Terminator, concerned that right now this conversation might be taped and someone might, I don't know, offer me a better headset if the sound quality is not good. And even where people did say positive things about AI, and there were some positive comments about things like autonomous vehicles, they were almost always coupled with a negative concern just about the uncertainty of AI's impact on society and on privacy in particular. So when we presented people, though, with health AI research scenarios, we got a very different response. And I'm not going to go into detail here. I'm going to show you information about the scenarios, but I do want to highlight that in each case, we took great care to construct ones that would include points that were potentially contentious based on other research. And I can talk more about that in the Q&A and offline if people like. So one was about using machine learning to sift through large amounts of genetic data to study cancer cell evolution. And the idea is that if you found a cancer in the ovary that had originated in the colon, you might treat with a colon cancer drug, so potentially benefits for patients that way. One was about an AI-based app that was intended to help older adults, developed by both academic and industry researchers working together. And then the last AI research scenario deliberately didn't really have a specific benefit. It was more about establishing some data infrastructure that would be used for multiple purposes, including by students and companies. So what did we find? Well, in contrast with those, terms about AI in general, people were really quite positive about all three scenarios. And you can see from the quotes here, we had language like, I think it's fantastic, I think it's great. There was the perception that the more data that's collected, especially if AI is brought to bear, there would be the possibility of generating knowledge that wouldn't be possible with humans, and also the possibility of using AI to generate results faster and near real time that wouldn't be possible with human analysis alone. But it wasn't a uniformly positive response. There were some fears and perceived drawbacks of AI. People worried about the people that were going to be doing the AI. What about their integrity? They worried that not just for the AI research, but the product of the AI research might lead to things that eliminate human touch, which is very important to the people we talk to in terms of healthcare services. And where there was company involvement, they worried that the data that they provided for one purpose might be sold or misused for some other purpose that they didn't agree with. One of the things that I really appreciated from our participants at the focus groups is that they didn't just talk about hopes and fears, they had really concrete suggestions about what would make the scenarios more acceptable to them. And the key one was transparency. And I think this really builds on the panel that we had earlier this evening or earlier in the morning for some folks. People really wanted to know why data were being collected, who was going to use them, for what purpose, for what benefit. And it was that more than detailed consent that was important to them. And in fact, when it came to things like consent, I love this quote here that when we attempt to be transparent through a lot of language, they might get the sense that we're maybe being, as I said, a little bit tricky because people may click on accepting without really realizing what they're agreeing to. It was also important to people that things like names and other identifying information were removed because they did appreciate there was a risk of hacking, but they felt that that would minimize the impact of hacking occurred. And then finally, this was an overarching AI-specific condition. They really wanted to know that the AI research was aimed at creating tools, nothing that would replace a human, things that would assist human decision-making, always humans in the loop. In terms of the strengths and limitations of our studies, I think it's a good and thorough analysis about how members of the public and diverse members of the public feel on this topic, the realistic health AI research scenarios. The detailed scenarios themselves, I think, as a strength, incorporate these points that are likely to be contentious and elicit discussion. And our hope is that they will be useful beyond our research study, potentially for teaching courses on topics like AI and society. In terms of the limitations, notwithstanding that we had diverse participants, in no way was this a sample representing specific subpopulations, so you'd need to do more work, and clearly there may be variation depending on groups and other jurisdictions. And then finally, given the really very low knowledge of AI going in, it's possible that the participants would feel differently if they knew more about AI and what it can do. So, summary and conclusions, participants in our 6 focus groups in Ontario, Canada had mixed, mostly negative perceptions about AI in general, but in contrast, they were generally positive about 3 realistic health AI research scenarios, but with some conditions and limits. They wanted to know if, how, why, and by whom their data were used. That was a key point, but it was emphasis on basic information versus necessarily wanting informed consent in all cases. And though it wasn't an objective of the study, we found that these realistic health AI research scenarios had an educational effect. So final conclusion is that the focus group participants, none of whom were AI experts, really had some important insights and concrete suggestions about how we could make health AI research more responsible and acceptable to members of the public. And that concludes my talk.
Thanks very much, Alison. Absolutely fascinating. And I love to hear this material about engaging with the community, because I do personally think that the social license that we need to build for the use of AI is going to be a really big issue going forward. Alison, if you wouldn't mind, yep, great. Unsharing your screen. Our next speaker is Ted McDonald. He's a professor of economics from the University of New Brunswick in Canada. Ted's going to be discussing developments in relation to the New Brunswick Act respecting research. And so it's over to you, Ted. Thank you.
Thank you, Carolan. It's nice to be here, sort of virtually. So just a bit of background for this presentation. So 2 years ago in Calgary, I presented the preliminary outcome from what I think is a pretty novel approach that our provincial government, the province of New Brunswick, took to helping us to set up a data center. And so the topic for my presentation today is 2 years later. Let's see how it ended up. And I'll give you a clue from the title: A Data Trickle Turns into a Flood. So, and I've got November 9th, 10th. It's the 9th here. I think it's the 10th. Probably lots of other places. So what is the New Brunswick Institute for Research, Data and Training? So there are many different kinds of data centers, facilities, and institutes across the world, and we've heard lots about them from different ones. And so I'm going to detail what my small provincial administrative data center is what it is. And a lot of this first part is going to be fairly standard. So we operate as a provincial research data center and a data custodian as defined in legislation. We host, similar to lots of other data centers, de-identified, so prepared versions of person-level data sets that are linkable across programs in a secure environment. One of the differences perhaps with other provincial data centers in Canada is that our relationship with our provincial government was an all-of-government approach from the beginning, so that the plan was always to set this institute up at arm's length, but to have it for all of government. A lot of the data centers in Canada are mainly focused around health data, and that's probably because health administrative data are the most widely available. But this, from the beginning, was a partnership that meant to be a resource for all of the government across multiple different departments. And so we launched in 2014. And if you're not sure where New Brunswick is, there's my little map there. We're in the bottom right corner, part of our COVID-free bubble. So early on in the setup, around 2014, we got our first data set. 2015, we were launched as an institute. But soon after that, as we developed partnerships with other departments in an attempt to get more data, an unhelpful lawyer in the provincial government said that unless there's a clear legal authority defined in legislation for data to be shared with NBIRDT, it can't be done. So although in 2013, our Personal Health Information Protection and Access Act, or FIPPA, modified legislation to allow us to exist and to hold data, it was determined that although FIPPA is a piece of legislation that covers all health information, it doesn't supersede other legislation. So the issue was that was only one piece of legislation, FIPPA, that allowed us to receive data, and no other legislation specifically said that. And so what this meant was that data transfers actually stopped almost before they began. And this meant things that were directly relevant to health, such as the Medicare Act for physician billing. Medicare Act didn't say anything about legislation. Right to Information Protection and Privacy Act, which is everything that's not health information, and specific pieces of legislation, such as the Family Services Act and Nursing Home Act. And it also meant that there was no clear authority for any department to share data with the Department of Health for linkage purposes. So 6 years of background, it sort of comes to a grinding halt with that one interpretation. But we have some really, really innovative champions in government, and that brings me to the Act Respecting Research. So the idea here in our province was that it was impractical to change 57 different pieces of legislation, one at a time, to go back into the legislature each time. So we worked together on this for a year, an omnibus bill that would modify and layer over existing pieces of legislation. And so, and it also provided an authority for the Department of Health, who do our data linkage for us, to receive data from anywhere in government for data matching purposes only. So ironically, departments find it very difficult to share data with each other, but they can specifically for linkage with us. So Bill 57 was proclaimed into law in 2017, and I presented 2 years ago on this legislation and all it took to get this underway. It modified 10 or so pieces of legislation, but then they missed a few in relatively rapid pace to get this in. They missed a few key pieces of legislation. So back into the legislature under a different government, Bill 29 was proclaimed. So what the outcome of this was that obstacles to the transfer of administrative data were narrowed to specifically operational issues. So the authority to receive, the authority to transfer were solved with this piece of legislation. It didn't compel anything, but it allowed this to happen. So it really comes down to resources. And we've been working very hard to standardize our procedures. So here's my graph. This is the trickle turns into a flood. So these are the number of distinct data sets, not waves of data, but distinct data sets that we hold. 2014, 2015, we had 1. 2016, we had 4, and that's when the brakes went on. And then 2017, with passage of the legislation, it started to increase. Again, with 2019, piece of legislation allowed us to increase. Now we have more than 40, and we anticipate having 50 different pieces of legislation from 6 different government departments, all linkable at the person level by 2021. I think, you know, New Brunswick scale, that's a flood. How do we do this? With master data sharing agreements, which facilitate the transfer of any data set from these organizations. So the key departments of the provincial departments, health, social development, post-secondary education, training, labor, these facilitated the process for data transfer. So what started off as a single data set in 2015, we have this first page, which are just from the Department of Health. And these are all linkable at the person level. So citizen database, which is our Medicare registry, chronic disease, healthy toddler. So a lot of these are sort of standard data sets that you would see in a health repository. But where the legislation allowed us to do is to get into electronic health records and data from our regional health authorities. So a lot of clinical data. So chemotherapy, diagnostic imaging, pulmonary function, HbA1c for diabetes, trauma, clinical ALS, and pending a bunch of other information. But where we really get into the social determinants of health are in the data sets we get from other departments. So we already have pretty much all of the K-12, so kindergarten to 12, education records for the entire province. Grades, so report cards, attendance, some health information, provincial assessment scores, some early childhood evaluation, early years evaluation, adult training and literacy, immigration records, a suicide registry, and most recently, data on programs and graduation from our universities and community colleges for the entire province. And pending, we have a lot of other information you can see there, right from justice, so court appearances, motor vehicle accidents, social support, and also some industrial data as well. So with this piece of legislation, it didn't compel anything, but it enabled departments who wanted to share with us to be able to follow the standard process and transfer data. So, well, what's the payoff for the departments? We have what this allowed us to do and facilitated the government to put resources into preparing data. We have a series of research agreements. Each of those comes with significant funding. They identify priority areas for us to undertake research. And one of the advantages for us is that these government departments, when they have these questions, they can't share data with each other. So they come to us and we can do the analysis in partnership with them. So 2 years from now, I think we'll continue to grow. I have to worry about a sustainable size. But I think our New Brunswick approach to this kind of omnibus legislation with a willing and active government participation has really revolutionized our approach to sharing and using data in the province of New Brunswick. So, and thank you. That's it for me.
Thanks, Ted. I'd have to say clear legal authority to share information is something we dream about in Australia. So we've got the same problem. So I'm thinking that your lawyer was probably being very helpful. Anyway, thanks for that great presentation. And I'd just like to note that we've got over 100 participants listening in, so that's great. And if you do have questions for the speakers as they present, please do log them in the Q&A and we'll get to them at the end of all the sessions. Our third speaker is Research Professor Amy O'Hara from the McCourt School of Public Policy at Georgetown University in the United States. Amy will be giving us an update on US federal data policy. Over to you, Amy.
Sorry about that. All right, we want what TED has, and we want it for the whole of the United States. But as many of you have been riveted to the news with all of us, we have a number of other things to fix first. But I'm going to be talking to you about a couple of the initiatives that have been underway in the US for several years now. And I hope to wrap up with a bit of optimism about the future path that these pieces of legislation and strategies will be on. The first one I want to talk about is the commission report. Several years ago, under the Obama administration, a commission for evidence-based policy making was seated, and they produced a report that had a number of recommendations. And the recommendations focused on improving access to administrative data for evidence building, and doing so with a great deal of privacy protection for the individuals in the data. This was focusing largely on federal data sharing between agencies, which is very challenging in the US because we don't have a National Statistical Act. We don't have a National Statistical Institute. We have a lot of them. We have dozens of them. There are 13 principal statistical units in the United States, the largest of which is the Census Bureau. Even in our Department of Health and Human Services, there's a statistical unit that is actually somewhat independent from the Centers for Disease Control. So in the US, you have all of these states that have their own data systems that have some requirements to roll data up to the federal level, very, very little coordination at the federal level to harness the power of that information, to understand what's going on in the communities, and also to have better planning and policy making. So this report was really crucial for coming out with the roadmap that could be taken to increase the use of data and focusing on that infrastructure at the federal level. So after the commission wrote its report, a law was actually passed during the Trump administration that was called the Foundations for Evidence-Based Policymaking Act of 2018. And a lot of us were really excited that this act got passed, but then you know that the political situation in the United States meant that real action on this was going to be pretty difficult. The act has several titles. One of them in Title I there, it's the evidence building activities. And it required federal agencies to name chief evaluation officers, chief statistical officers, and form an advisory committee to look at the best ways to use the data. The second is really about open data, and it required agencies to come up with data inventories and name chief data officers. But when you think about this in practice, if you're a government agency, you now have an unfunded mandate to have these 3 new positions. So in many cases, they took executives that already had day jobs and gave them these additional roles to play. And in addition to that, they had very little coherence across what it meant to be a chief statistical officer or a chief data officer across the different departments in the US government. The third part of it there, and this really follows on what Ted was just saying, it beefed up this act, CIPSI, the Confidential Information Protection and Statistical Efficiency Act in the US. They believe it was telling agencies to say yes unless. So that would mean you have access to data, though no compelling requirement to share data, but that federal agencies were supposed to be able to share data across different governmental units unless it was explicitly prohibited by law. There's a role at the US Census Bureau where I used to work that they are able to get access to data regardless of what the purpose it was collected for. So there are pockets of the US government that might be better places to do the data joining. As he mentioned, the Department of Health was doing this in his province. The Evidence Act also required that the agencies try to come together and figure out how to have a common portal for researchers to apply for data. So that is something that is taking quite a while, because you can imagine with the patchwork of different requirements in the statute and regs in the US across the different agencies, it's difficult to have that single front door that efficiently drives a researcher through the process of requesting the data. The Title IV there's really no new funds to implement the Evidence Act, but still it was very encouraging to see this signed into law during the Trump administration. The act has been implemented, and the different government agencies and departments have been tasked with setting up learning agendas. What are the questions that your agency or program needs to answer? They're trying to figure out how they staff and have the right resources to use data effectively, and how to set that up in their plans, both their plans for acquiring data and also conducting the analyses or holding the data through data management plans. The next phase is about pushing open data further and being able to manage the open data portals, and getting agencies to figure out what would need to be redacted or what statistical series would need to be produced in order to have more transparency and more data available for use by the public. The third one is the one that I'm really interested in, the data access for statistical purposes. And in the US, especially in the US government, statistical purpose means that it won't be used for surveillance, for enforcement, or for marketing. So it's when you're using the information in a way that will not affect the provision of benefit or any benefits taken away from any single individual. And then also pushing forth into program evaluation. The little screenshot I have there from the White House, the Office of Management and Budget, this is a standard way that acts are implemented in the US. There was a memo sent to all of the government agencies, and it tells you how you're to implement this act, but then it doesn't necessarily give you any funding to do it. So there are encouraging words, but not necessarily carrots or sticks at this point. One of the requirements in the implementation of the Evidence Act was to set up an advisory committee. And this committee will meet for 2 years, and after the first year, will provide recommendations to the Office of Management and Budget, again, that's the White House, the executive branch in the US, on how to facilitate data sharing and enable data linkages, and also to develop privacy enhancing techniques. This committee just started meeting last month. It has 26 members. I am honored to be one of those members. I was nominated by the American Statistical Association and was selected, and we're beginning to meet. And just to speak frankly about the direction of this advisory committee, it's going to be putting out a request for public comment. And it's going to be fascinating to see who responds to that, because in many cases, there are lobbies. So there's the student privacy lobby, or there's the health data lobby that will respond to this. And I'm eager to see if we do get a blend of academic, public sector, and I would love to see more participation from the private sector, especially since the advisory committee has to be thinking about ways to improve privacy protections, and ideally doing that without really buying into just one technology. So it will be interesting to see what path this will take, whether it would be an integrated data solution, a federated data solution, what the different opportunities for tiered access will be. And we're going to be meeting multiple times every month in order to come out with that report that will be due a year from now. But that is definitely an exciting development. The members include some people from academia, a number of current federal employees, and then a handful of people from the US states that represent administrative data controllers in the states. Another aspect is the federal data strategy. So in addition to the law that was passed, the Evidence Act, the Trump administration put forth a federal data strategy. And this isn't really, Donald Trump or any of his inner circle. These are the career feds that work at the Office of Management and Budget that have been working toward these issues for a very long time, just making that stepwise progress. And the federal data strategy has these main focus areas about having cultural change across the government agencies, figuring out ways to have better data governance and data management plans to protect the data, and then to promote efficient and appropriate data uses. And the screenshot on the right there, the action plan they put out, had a lot of information and steps for agencies to take to figure out how they could engage with their data users. And that was both to figure out the direction that the open data strategy should take, as well as the access to research data. So there was a lot of encouragement to figure out who their stakeholders were, who their users were, who had unmet needs, and how that could be addressed. They also came out with a data governance playbook, nothing really flashy in there, but again, it's just thinking about what the right steps to take are for the federal government to gain access to more information to inform policymaking. So these slides were due before our election, and I didn't know what direction it was going to go. So this was my final slide that just said, now what? And I think that a lot of us are still waiting, but we do expect there to be a pretty significant sea change between the types of data collection and transparency that the US has experienced in the past 4 years and what we could expect in the 4 years coming up. There has been an erosion of trust in the federal government, in the statistical system particularly. In the US, we've had so many problems with the accuracy of reporting COVID cases and deaths. The Centers for Disease Control has kind of taken it on the chin. And for those that haven't been following, 2020 was the year that we had our decennial census, and that has been beset by challenges. In addition to the challenges of having delays because of the pandemic and not being able to collect data through door knocks, like approximately a third of the households in the US are typically contacted by enumerators to collect the data, and that was definitely impacted. But the US also had wildfires and hurricanes. So if you were really thinking of ways to complicate a collection so that the US would have really quality denominators, all of that happened. So what's going to happen from here on? How do we have the repair of trust and integrity and credibility in federal statistics? How do we rebuild the core of individuals that have worked in government and give them the tools that they need and the funding that they need? These are some of the challenges that will be coming up that hopefully the advisory committee will be working on. And I suspect that we will see further legislation. We will see perhaps executive orders, not of the type perhaps that we experienced in the last administration, but in a way that could help to rebuild the important statistical infrastructure in the US so that there is a federal data strategy and the encouragement to build evidence for the policymakers. And so to really dig in and reset that capacity in terms of the technical capacity as well as the human capital. So that is my update on at least part of what's going on in the US. And stay tuned. I'm sure that we have many more exciting and nail-biting things to come.
It's certainly been exciting and nail-biting, Amy. Thank you very much for that. It's great to see that data is being explicitly acknowledged as the basis for evidence-based policy development. It's very explicit, which is great, and I completely agree, and I look forward to discussing further with you the importance of trust, because it seems to me that trust underpins everything we do in the data linkage context. Thanks, Amy. Our fourth speaker is Lucy Carolan. Lucy has a background in public health and is a research assistant at the Australian Centre for Health Engagement, Evidence and Values at the University of Wollongong, south of Sydney, here in New South Wales, Australia. Lucy will be discussing a project that looked at best practice in linking and sharing administrative data, and it was using a comparison of views in health and higher education. Thanks, Lucy. Lucy, are you on mute?
Sorry about that, false start. Can you hear me? Yes, I was on mute, Carolan. Thank you. As you said, I'm speaking from Wollongong, just south of Sydney in Australia, talking about the Enabling Big Data Research project conducted by the Australian Centre for Health Engagement, Evidence and Values. I acknowledge the Aboriginal custodians of the lands, the Dharawal and Gadigal people, and their elders past, present and future. So this research compares the differences and similarities in the way big data is used in the health and higher education sectors in Australia. And we are currently midway through this project. There are large and complex administrative data sets in both health and higher education in Australia. In Australia, health, with the combined workforce of close to 850,000. You'll be familiar with big data sets in health, hospital admissions and disease registries, for instance. You may not be so familiar with the data sets collected in higher education. So there's demographics, including schools attended, academic results, so that's both university grades and high school grades, student categories, which refers to domestic or international students, disadvantaged students, students who might be distance learning, and then student behaviours. So these are any touch points with the university: attendance, online learning, logins, library activity, database visits, and health service access.
Lucy, sorry to interrupt, but did you have some slides that you wanted to show?
Yes, are you seeing a slide?
No, so you might need to share your screen.
Oh, okay, sorry, I thought I had shared it. Can you see your screen now?
Oh, well, Ted can. I'm not sure why I can't. So perhaps it's okay. Okay, tech support says yes.
Oh, good.
So that's great. Sorry.
That's okay. I was lucky. I was just hoping I wasn't pulling any funny faces. Okay. So the purpose of data collection in universities is for student success and experience, the identification of at-risk students, at risk of failure, recruitment of staff and students, and also reporting to government. Oh, sorry. So we purposefully recruited stakeholders in these sectors to be interviewed. Health participants were recruited through their involvement with the Population Health Research Network if their contact details appeared in the public domain. Higher education participants were identified through a research we'd previously conducted on staff and student attitudes to the use of big data. We asked participants about the ethical, governance and policy challenges they had experienced associated with big data and the implemented or imagined solutions in these sectors. Dr. Jackie Street conducted all 18 interviews. Here's a snapshot of the participant backgrounds. So in health, participants were data custodians and experts in the use of large public data sets in health in Australia. In higher education, participants were IT and teaching specialists, in learning analytics and/or data analytics in higher education in Australia. So now I'll talk about our findings. We found that, broadly speaking, the range of ethical issues that participants in this study reported were similar, although how participants described these issues and why they were issues varied. I'll talk briefly about each of these issues, the identified harms, and the actions to address them. First, I'll look at the similarities, then the differences between the sectors. And finally, I'll touch on future recommendations made by the participants. An ethical issue similar in both sectors, participants reported that privacy and confidentiality are at risk when big data are collected, linked, and used for secondary purposes. The main concern raised was that the data are never permanently de-identified, and privacy and confidentiality therefore cannot be guaranteed. Participants in both sectors highlighted that new technology allowed researchers to combine large data sets in ways that could lead to a loss of anonymity. Again, an ethical issue similar in both sectors. Participants expressed concern about the ways in which data sets were being shared. Participants thought that some individuals or groups were gaining access to data sets when they should not. Participants in the health sector said that clinicians gain access to data for clinical care, but some of these clinicians then use the data for research purposes. Similarly, in higher education, a participant described how academics are using data beyond the purpose for which they are collected. So harms. A number of potential harms were raised by participants. The issue of unnecessary surveillance was a similar concern in both sectors. One participant in health going as far as saying that by linking data sets, we are creating a surveillance state. The surveillance of student movements and behaviours in higher education was described by a number of participants as making them feel uncomfortable. So now a notable difference between the sectors. The erosion of public trust was reported as a community or population level harm or group harm by participants in the health sector only. Participants said that this erosion of trust was due to the mistrust of government to be transparent and to use the data correctly, inadequate community engagement to identify what is important to society when it comes to data use, private industry involvement, and also past mistakes and data breaches. Participants said they were concerned that this may result in individuals opting out of healthcare to avoid having their data collected. Another difference between the sectors was the identified harm caused by the unconscious bias and stigmatisation of certain groups that could go unnoticed. This was reported by participants in the higher education sector only. Participants described feeling uncomfortable that students could be disadvantaged based on their demographic information if this level of data was accessible. Further, the use of machine learning in the sector was raised by participants, concerned that biases would be missed and perpetuated. Again, a difference in the sectors. Only participants in the higher education sector expressed concern about the lack of clear policies surrounding data use and a lack of transparency regarding what data is collected and what it will be used for. As a result, one participant described their institution as being so risk-averse that research was being stifled. Consent. The way that issues around consent are reported to in each sector are poles apart and a clear difference between the sectors. In the health sector, participants said that legislative provisions take the place of individual consent, that is, a waiver of consent. In contrast, multiple problems were raised by participants in the higher education sector that relate to obtaining consent from individual students. So actions. I'm going to talk about the actions, which are the ways the sectors manage the ethical issues and potential harms. Participants in the health sector describe the provisions that are currently in place. So they have some data management principles, for example, the 5 SAFE framework, legislation and policy, privacy acts, There's a waiver of consent, and laws are in place to prevent private sector access. In contrast, however, participants in the university sector reported a lack of formal governance principles or legislation for learning analytics, and they only pursue individual level consent. So finally, participants made recommendations for the future of data sharing. Although described differently by participants, a number of recommendations in both sectors related to the development of a social license, with data being used for public good, as well as the need for community engagement and education around the value of data and its benefits. Over half of the participants in the health sector expressed frustrations with delays in the process of data linkage and sharing, calling for a true national system to assist with the flow of data between jurisdictions. The most obvious difference between the sectors was the call for participants for governance, legislation, policies and data management systems in higher education. It is worth noting, however, that the Australian Government's Data Availability and Transparency Bill exposure draft was made available just a couple of weeks ago, and it does now include a guide to the use of data in the higher education sector. Thank you, and thanks for listening, and welcome any questions.
Thank you very much, Lucy. Really interesting that trust was highlighted again as an issue. And it struck me as very interesting as well that where there are significant policies in place, trust is an issue, but where the policies are a bit underdeveloped in the higher education sector, trust was not an issue. So that was a bit perplexing. All right, well, thank you to all our speakers today. It's been really a fascinating hour or so, and I'd like to now move into questions. We've got some really great questions coming through on the Q&A, and we have almost 20 minutes for questions, so that's great. Okay, so let's have a look. A lot of the questions relate to data that's gathered with legal authority and then shared with a research institute. And then the question is, what happens next to that data? So we have a question here for Ted in relation to whether it's possible to share with third parties. And a related question to that is whether it can be shared under any circumstances with the private sector. So perhaps you'd like to address those issues.
Yep, I'll try and be brief. I saw there are a lot of questions. So to that question, the authority for us to receive data in legislation, it specifies data can be shared with a provincial research data center. So IRDT is not a named entity, but it specifies data can be shared with a research data center. We happen to be the only one, but then it says that a research data center must be established according to originating and operating agreements. So the province controls or can approve what becomes a research data center or not. Once you are established as a research data center with all the policies that go along with that, so they can disclose to us. So we then have the responsibility for providing access, and that can include to the private sector. But the limitation on that, or the check on that, is that everything has to go through the policies that we've jointly developed for access with the province. So the private sector can get access to it, but it goes through the standard procedures. Also, the government cannot disclose to any other entity unless it is a provincial research data center. So if another entity wants to go through the whole exercise of setting all of that up with all the agreements that need to be in place, they would then also be authorized to receive the data. But trust me, there's 10 years of work. It's not going to happen. Thank you.
Interesting. I've been doing some work with the University of Wollongong recently on sharing with the private sector, and I see that Jackie's Jackie Street from the University of Wollongong has logged a question as well. I wonder if any of the other speakers would like to comment on sharing of data with the private sector, because for us, it's a sort of at the leading edge of issues that we're dealing with at the moment, and clearly raises some very contentious issues. Anyone else have some thoughts?
I can say a little bit. So I'll say a few things about the process for private sector researchers to work with ICS data, and all of this information is available on the public website. But I'm going to say it goes back to, I think, 2015. We actually did a series of focus groups with members of the public about use of linked data in general, not AI or ML, but just in general. And there were 2 rounds. In the first round, commercial involvement came up as a big topic. And in the second round, we had scenarios that really focused on commercial involvement. And like many studies, ours showed that there are heightened concerns when there's private sector involvement, but people did see some benefits. So just, going top of mind, they would say, well, when you get often the private sector can pay people with significant skills, and they might have different perspectives than some academic researchers. Other people commented on how they saw it as an example of private and public sector collaboration, which they like to see. They like to see the sectors collaborating. So at the end of the day, and very much based on what we heard in those focus groups, ICS adopted a policy where essentially the private sector researcher never touches the data. They are responsible for the study design. They take advice from ICS scientists, but it's the private sector organization that owns the study design and the results. And there's an understanding up front about what the limitations will read based on the choices being made. So I don't know the exact number, but maybe on the order of 10 private sector studies have now gone through ICS. And transparency, they're all on the website, including those that are in progress or on the ICS website, so members of the public can see what's happening.
Great, thanks, Alison. Did anyone else want to comment on that?
Super briefly, I'm also the director of the Georgetown Research Data Center, which is one of the 30 enclaves where you can use restricted government data in the US. And the rules there for authorized and credentialed researchers are so narrow that you have to be from an academic institution pretty much. And that has been very challenging in the US because there are so many people with data analysis needs that are at the state and local level that even those officials have currently been having difficulty getting in. So we're really grappling with what it means to be a credentialed researcher and whether and how that could include those from the private sector. We are looking at some of the data commons that do allow some private sector uses as models for that.
Yep, Amy, while I've got you, could I just follow up with you for a couple of questions from the live chat? So Luke Hendrickson has asked whether, commented that sharing data costs money, which we all know, in terms of time and effort. So with no new funding, how have US agencies carved out funding for this work, and what activities are anticipated to be lost if efficiencies can't be found?
So the way it stands, executives need to define what their current budgetary allocations are, define a research project there. And the best way to do that has really been by saying this is evidence building or understanding the efficiency of the program. Yeah. But that can be very narrow. That's actually too narrow in my opinion, but that is how they've been doing it to date. Also, you can try to get external grants or work with folks on the outside, but that's not really evidence building for government's sake, but it is building evidence through the use of NSF or NIH funding, which are the big science funding organizations in the US, in order to get access to some of these data for those purposes, especially for public health. That's how it's been happening.
Yep. And there's another question here for you, Amy, that if a researcher needs to link data across government department agencies, where does the actual linkage take place? So is the data downloadable to researchers or on a secure platform that researchers need to access to analyze the data?
To date, the US Census Bureau has been acting as that trusted third party doing linkages. They can do it as a service, but they've mostly been doing it for projects that want to link into the census data. All of the data must be used at a dumb terminal, so no one has the ability to download data, and it's highly, highly controlled. And in order to get any results out of the system, you need to have the results pass through a disclosure avoidance review. Otherwise, it is a closed system and nothing leaves.
Great. Thanks very much, Amy. A couple of questions here in relation to AI. So the first question relates to public literacy around AI, which clearly is an issue, I think, from Alison's research. So wondering whether AI ML researchers themselves need to be a little bit cognizant of that and not to super hype their very sexy projects. So do researchers have a role in, moderating the response of the public? And I guess I'd add a question of my own there in terms of how do we raise the awareness of the public in relation to the reality of AI in health, because it seems to me there's a bit of a gap between what's actually going on and the public's perception of what's going on.
So thanks very much for the question, and I saw both of them in the Q&A panel. And I do think, so the first answer is, do I think the public's AI literacy has an effect? Absolutely, it has an effect. And I would say this study provides evidence in that, because the stark contrast we got between these sort of utopian and dystopian statements at the beginning, and then literally about 25 minutes per health AI research scenario, the things they were saying were so different in tone. It really makes you wonder, how scenarios, not just in health, but in other sectors, could really improve literacy generally, because there's no question that members of the public, many of them are quite interested in AI and will, ingest information that's available. In terms of the role of AI researchers and, fueling the hype, of course, there's going to be variation. We've seen other things. I saw nanotech in my day. I saw, things around at the start of the genomics revolutions, there's clearly waves in terms of what people are willing and interested in funding. I would say that honestly, compared to other big trends in science, I've seen the AI and machine learning researchers stepping up more than I saw scientists in the past. So for example, the Montreal Declaration came out of the University of Montreal. AI scientists are working together. They're signing petitions against using AI in lethal autonomous weapons. So it's not to say that every AI researcher is doing the right thing, or every AI researcher or ML researcher is equipped to communicate with the public. But overall, I think that we just need to really get more tangible examples out there, while acknowledging, as the AI scientists do, that there are some legitimate, fears and downsides to the technology.
Great. I feel like this question of community engagement and raising literacy levels about the various issues has come up in almost in relation to each presentation. And so I wonder whether other speakers would like to talk about their views on engaging the community in these issues and raising the literacy among the community in relation to these issues. Nope. One I had in particular for Lucy was, it was interesting to me that the two sectors were so different in terms of their, in terms of sort of trust and understanding of the issues actually. And so I wondered whether those two sectors, health and education, what they could learn from each other in terms of governance, in terms of raising awareness, that the health sector has a much more developed governance system. And you mentioned that the higher education sector might learn from that, but I wonder what the health sector could learn, for example, from the higher education sector.
Maybe just reflecting on what the other speakers spoke about this morning, about the difference in consent now, because I know that obviously in health there is that higher level consent, but the universities still act on an individual consent with the students. And I think some of the speakers earlier today talked about the fact that consent is such a movable feast, if you like. So, I mean, engaging with the students regularly on their journey, for instance, came up a lot in the health education interviews, but whether in health, they engage with patients more often, or, there's a more regular engagement perhaps.
Yeah, okay, great. And I suppose I'm also interested in the extent to which you gained an understanding of the issues that undermine trust in government, but don't appear to undermine trust in higher education. Do you think it's just the consent model?
That and maybe the publicised data breaches, things like that. So it was sort of a competency in government, trusting government to do the right thing perhaps, or not make the mistakes, or knowing how to handle the data sets and keep them secure, although they are willing to trust, Facebook and things with their data, but the same sort of breaches haven't come up in the university sector.
So Ted, I'm wondering, like the utility of the data for the development of government policy seems very clear to me, but can I ask sort of what efforts are being made to engage the public in relation to the use of their data? And it's coming at the same issue from a slightly different angle. And I just wondered whether, the overall strategy, for example, had a community engagement aspect?
Yeah, it does. It's in its early stages, but absolutely part of what we need to do and what we are trying to do is engage with the public, just about raising awareness. So there is a tradition of sort of patient engagement around research, health research. And in fact, a lot of our funding comes from a CIHR funded initiative around that. But in terms of just engaging with the public to let them know that this is happening, what we are doing with it, and to get their input on how they feel about it is something I think is important across the board. Statistics Canada is doing this, Health Data Research Network of Canada is doing this. And I think it's really comes back to that social license. And what in our preliminary discussions, what we found is sort of surprise that people said, well, I just assumed that you were doing this anyway. And I just related to that, it's kind of, I just assume government is using data to make decisions. If only they knew how a lot of decisions are made, because the capacity to be able to link data and evaluate and do program evaluation just hasn't been there. So I think they're based on our early discussions and from what I've seen across the country, there is a great willingness to see this, but it really has to emphasize what the benefit is, that this has to connect back to policy, social service development, and for the betterment of the province. But if you can make that case, they're on board. There is an issue around commercial access, though, as other speakers have talked about.
Yeah, so I guess the same question to Amy. Is there a part of the strategy that talks about community engagement?
I'm trying. On that advisory committee, I have introduced the concept of social license. And while there is a specific effort to get stakeholder engagement, it's the extent to which a national organization or a speaker on behalf of a demographic group is really adequately reflecting their intent or their risk profiles or what they believe are harms. So we're really trying to figure out how that can advance along with this Evidence Act implementation. But it's definitely something that would be tough to implement at a federal level. Telling the Department of the Treasury to do that is not really effective. Yeah. So it's going to have a lot broader partnerships and a base to do it. I think really rebuilding the trust in government numbers and facts is going to be critical for some time.
Yeah, it might be something that needs to be done at the state level, I guess, given the, where services are delivered and where the interaction is. Amy, I just had one other question in relation to your presentation this morning, and I'm interested in it because we have a little catchword here, which is because of the Privacy Act. So you don't do something because of the Privacy Act. And I wondered whether the yes unless approach was sufficient to overcome this sort of risk-averse approach of public servants who might be concerned about breaches of privacy. And it links into Ted's presentation where the lawyers have said what we need is explicit legal authority to share. And I wondered whether, you know, what your views were about that. Would explicit legal authority to share be better, more effective than the yes unless approach? And we've got 2 minutes till end, so that might be the final word.
It would be great to have the more explicit language. I think that there will be a lot of challenge even dealing with the yes unless or with an explicit directive. There is a real lack of capacity and often a lack of will, and the data are poorly documented. I don't want to make it sound hopeless, but there are a number of obstacles, as all of us are aware of, whenever you're repurposing administrative data. I think that there's going to need to be an investment in capacity, both the technology, the standards and norms, as well as the human capital in order to overcome that, in addition to the massive cultural change, which would get people willing to do it.
Okay, so we're nearly to the end, and I'd just like to thank all the speakers in today's session. The recording of this session will be available on the conference platform in 48 hours time. And if you enjoyed this session, you may also be interested in today's featured on-demand videos and posters, and you can find these in the on-demand gallery. Thank you for joining us.